Hollywood actress Selma Blair recently announcing that she has multiple sclerosis. But how much do you know about this disease, and could you be at risk? Dr. Thompson is joining us this morning. She's in our open door green room. We'll be chatting with her about MS and what we all need to know coming up. Good morning, Arizona. It's 10 minutes after 8. Actress Selma Blair making headlines recently after she announced that she has multiple sclerosis. Here you'll see her out on a red carpet for the first time since sharing the fact that she had been diagnosed. She got the diagnosis last August, and at first apparently she thought that she was just suffering from a pinched nerve. So she again walking the red carpet for the first time, but as she was seen walking with a cane there at the Oscars, and apparently says she's had symptoms for years but didn't really know what was going on until the diagnosis so recently. So what is multiple sclerosis, and how does MS affect women specifically? Dr. Sharon Thompson from Central Phoenix Obstetrics and Gynecology joining us this Monday morning to chat about it. And you hate to hear when somebody says, oh gosh, I thought it was just, I mean, it's terrible news. Then you make the connection of, oh, I thought it was just a pinched nerve, and then our minds start to go, you know, oh, I feel this or I feel that. So how common is this, and who's most likely to deal with it?
So the general population has a risk of 1 in about 750 of getting MS. So it's not all that common, but it's not rare. So most of us will probably encounter someone in our lives at some point who has multiple sclerosis. Not a rare disease. But what's interesting about MS, we call it, the great pretender, because the symptoms can be any symptom in your body because it affects your nerve cells. And nerve cells go everywhere. So it can be, like she said, I thought I had a pinched nerve, or it can be bladder problems that go away, or it can be problems with walking that go away. It can come and go for many years like it did for her. And so people often miss it or dismiss it because the symptoms go away by themselves.
Wow. Okay, so we've got some of the contributing factors to that. Genetic factors, smoking, of course, it seems like smoking increases your risk of pretty much everything you don't want. Low vitamin D, what does body size have to do with it?
So MS is related to genetics. So people in families where folks have MS are more likely to get it. But it's not so clearly familial that if your parents got it, you're going to get it. But then there are other factors. Environment plays a role. We know that we see MS in regions farther away from the equator.
Oh, really?
And you saw on the list there was low vitamin D.
Yes.
So we wonder, is it because people farther from the equator make less vitamin D? The way the body makes vitamin D is sun exposure on the skin. So if you live farther from the equator, you're bundled up more. And is that what's happening there? So is it some interaction between your genetics, vitamin D, and then inflammation? So MS is a disease where your immune cells attack your nerve cells and cause inflammation and scarring. So what triggers the inflammation in the body? We don't quite know that yet. So there's so many factors that we know contribute, but we don't know what's the cause. What's the first thing that causes it?
Oh, that is so frustrating and mysterious. So symptoms, I mean, you would not really probably connect all of these dots until after the fact of getting a diagnosis,
and that's what tends to happen, is that folks come in. Now, sometimes the symptom can be so severe that it sends you right to the doctor. Let's say you start being unable to hold your urine and you're leaking all over the place. That's unusual, so you would run right to the doctor, and you may get diagnosed right then. But if your symptoms are more subtle, a little weakness in your hand, you might miss that.
Dr. Thompson, I appreciate your perspective so much.